The government of Andhra Pradesh, with a vision to provide accessible, affordable, and quality healthcare to the rural and tribal population, especially the vulnerable sections of society. Transformation of subcenter to eSubcentre in order to bring the benefits of latest healthcare technology solutions to the underprivileged population residing in rural and tribal agency areas. Noble initiative to transform the existing subcenters to eSubcentres, also known as e-health and wellness centers, through a well-thought-out PPP model, enabling access of MBBS doctors through telemedicine, diagnostics with latest medical equipment, and dispensation of medicines through automatic drug vending machines at the subcenters. This approach is intended to proactively deliver preventive, screening, and curative medical services and address issues related to seasonal, epidemic diseases, mother and child-related health issues, and NCDs. Services, equipment, and infrastructure provided at subcenter for upgrading to eSubcentre. The infrastructure provided at subcenters include refurbishment of subcenter building with required civil works, whitewashing, paintings and sanitation facility, Android tablet, printer and UPS, internet connectivity, network and data center for hosting of application and data, tables and chairs, desktops with IT infrastructure and connectivity at Medical Doctors Hub. Medical equipment provided at subcenters include automatic drug vending machine for dispensing medicines, multi-para monitor to test ECG, oxygen saturation, BP, temperature and heart rate, non-invasive hemoglobinometer, glucometer for testing sugar, lab consumables like glucometer strips, pregnancy test kits and malaria test kits. Training to ANMs, medical services provided at eSubcenters. Patient registration is done by unique ID. Patient vitals will be recorded through latest medical equipment and will be stored as an electronic medical record, EMR. The patient will be connected with the MBBS doctor through teleconsultation solution. The doctor will provide the plan of care through e-prescription. The patient will be provided with required medicines through automatic drug vending machines based on the doctor's advice. eSubcenters also provide outpatient care for acute illness, other epidemics, and seasonal diseases, antenatal care, and postnatal care services for women during pregnancy and after childbirth, screening and management of non-communicable diseases, NCD, medical care for elderly. eSubcenters help to reduce the disease prevalence through disease demographic analysis from dashboard for better preparedness and preventive measures. eSubcenters obviate the necessity of patients going to PHCs or CHCs. Patients can avail all the primary healthcare services at the eSubcenters itself. eSubcenters coming up in rural and tribal areas are really helping these communities immensely by providing medical care through doctors. Several people have benefited from the best of the healthcare in these remotest places where even basic healthcare is miles away. A few stories about how they are reaping the fruits of this digital revolution in healthcare. Annapurna, aged 18 years, from Kateru village near Rajamandri says, they had a great difficulty when her grandmother was suffering with severe pain in her knees. They had to rush to the nearby town Rajamandri for treatment. Now, with an eSubcenter coming up at Kateru, consultation and treatment are available a few paces away from their house. Over and above this, they are also getting free medication from the eSubcenter through the automatic drug vending machine. Madaka Pandu Dora, a tribal old man from a hamlet near Yendapalli in Rampachodavaram agency area of the East Godavari district, is sharing his experience of the eSubcenter coming up at Yendapalli. He says, in the past they had to travel to Gangavaram, located 20 kilometers away, for a consultation with an MBBS doctor whenever they had health problems. Now with the eSubcentre coming up at Yandapalli, it helped them immensely as they could reach the eSubcentre comfortably to have a video consultation with a qualified doctor located in a medical hub at Visakhapatnam. Timely and accurate healthcare services provided by these eSubcentres is saving and filling the lives of the tribal and rural population with joy